Good afternoon. The information I'm about to give you is the best information that we have available as of right now. And it is subject to change, and as you know from our previous briefings, information is changing sometimes hourly. With relation to the school that is closed, St. Mel's, today we received information that 3 more households were reporting symptoms. So far, our lab has 17 samples from children and families that are related to St. Mel's who have reported symptoms, and we'll be running those in the near future. We have also received 8 negative results. So far we have had no additional cases related to St. Mel's and no additional tests positive for influenza A H1N1 related to St. Mel's. We do have 1 new probable case of influenza A H1N1 in Sacramento County, which increases our total to 5. This new case is the first one that is not associated with the St. Mel's School. It does involve a healthcare worker. Onset of symptoms was 10 days ago. That's on the 20th of April, and because so much time has elapsed, our investigation will be much lower key than with all these other cases. The Sacramento County Public Health Lab continues to process specimens to test for flu both from Sacramento County and from surrounding counties. We tested 38 samples yesterday and we'll be testing 54 samples today. As you know, 211 is the main number in Sacramento County for general information about the influenza A H1N1. They report getting quite a few calls during the day. One of the issues that they have had to deal with in the calls is parents saying that schools are requiring that their children have to have a doctor's note before they can return to school if they have been out sick. We have requested schools in a conference call that we had today that they not require this for children, for the simple reason that our healthcare providers are also reporting to us that they are really stressed out and having a lot of folks call, people who might have influenza-like illness, who might have risk factors because they recently traveled to Mexico, etc. So insisting that a child get a physician's note prior to going to school just adds to the workload for our clinicians. So if a child is well, has no fever, we would hope that schools would allow them to return without a doctor's note. Also today, we had a meeting with emergency responders, both EMTs, emergency medical technicians, that work mostly with our fire departments, as well as with law enforcement. And we updated them on their efforts and what protective measures they can take. They are very valuable workers in our community, and we want to be sure that they are protected with using the proper equipment. The medical directors of the ambulance, of the fire departments and ambulance companies have, in coordination with me, issued guidelines for protection. And some of these guidelines for some of the ambulances would require workers, if they are responding to a call for someone who has a fever and influenza-like illness, in addition to wearing a mask and gloves, is also to use a gown. We do not want the community to become alarmed if they notice that ambulance workers are now wearing gowns too. It does not mean that we have any further spread of illness. It is simply that we have issued some guidance that will protect them further from the chances of getting sick. Another question that we have gotten this week today is what to do about events that are planned this weekend in our area. And we are at this point not recommending any change in plans for anyone as far as having any events that are planned. And the reason for this is we are a county of a population of 1.4 million individuals, and currently we have had 5 reported cases, all of which have recovered by now. So the chances of, given this information, the chances causing major spread of this illness in our community right now is low enough that there is no reason to recommend canceling of any kind of public events. Sacramento Public Health continues to work very hard, as you can imagine, following up on all these cases, contacts, etc. We have calculated that from Sunday through Tuesday, approximately 50 people have devoted over 863 hours of staff time just to this event. An incomplete calculation of salary and overtime spent, and that is because we don't have all the data yet, is about $44,300 have been spent just on this event. I must tell you that I am very proud of the dedication and professionalism of our workforce. They have really risen to the occasion, and although some of our routine work is falling by the side and is being postponed, the important emergent issues are being addressed. With that, I will stop and answer any questions you may have.